CDC regarding the duration of the quarantine. And on that note, I'm going to switch to the next slide and talk about what was released this morning from Austin Public Health. And I'm going to talk you through this. It may be hard for you to read, but part of the process of the interpretation of the CDC guidance is to weigh when people need a 14-day quarantine and when we can be okay with a shorter duration. I want to be very clear that CDC continues to say the 14-day quarantine is the safest route to go. They also point to the fact that people should be guided by local health departments on how to interpret this information. So this is our interpretation of that guidance. So if an individual is a close contact with someone with COVID-19, they face this initial question: was that exposure when masks were worn or not? If it was not, so if masks were not used, the answer to that question is yes. Then they enter a 14-day quarantine. So why are they in a 14-day quarantine? Because they weren't wearing masks. Because this is the situation where we are seeing efficient disease transmission. This is happening in athletic activities. This is happening in social activities. This is happening in carpooling. This is where we're seeing that disease transmission. Household contacts is another great example of that. So there is a much higher risk of transmission, which means we need to hold on to that individual for longer to ensure that we're giving it the full 14 days before we allow them to interact with other individuals in the community. If the answer to that question is no, if you were wearing a mask at the time of exposure, the next question is, do you live or work with an individual who is at high risk for severe disease? So this could be workers at nursing homes. This could be employees working in jails. This could be individuals who have someone in their household who is over the age of 65 or has a high-risk medical condition. If the answer to that question is yes, they also need to quarantine for 14 days, again, to ensure that we are limiting the potential impact on those who are at higher risk. If the answer to that question is no, the next question is, are they a first responder, EMS in particular, or a healthcare worker? If the answer to that is yes, then we are advising that they need to stay quarantined for 7 days, and on or after the 7th day, have a test which is negative before returning to work. If the answer to all those questions is no, then they can utilize the 10-day option or the 7 days with a negative test. So what's the difference between the healthcare worker, first responder, and this last option? The answer is the last option is that the individual needs to be tested on or after the 5th day and can be cleared on the 7th day. We want to be a bit more protective for our healthcare workers and our first responders because of the closeness of interaction with other people, in particular patients, and that individual who had been exposed. So that gives us 2 extra days to determine if that person is likely to develop disease or not. Again, we will be codifying this guidance in our city and county orders and rules to reflect these changes. I have faced the question, are these recommendations or requirements? They're requirements. And these are, this is the enabling legislation is in the Health and Safety Code, Chapter 81, which gives the local health authority the responsibility for controlling individuals who've been exposed to disease. So again, we have seen some information come out from the TEA and from the UIL with guidance for schools. Again, the TEA and UIL don't have that enabling legislation to provide guidance or institute rules associated with individuals who have been identified as exposed. Next slide, please.